The following program, Know the Cause, is paid for by Mediatrician Incorporated.
Folks, welcome aboard. We've got another wonderful show lined up for you. It's got many segments at the bottom of the show, and I didn't put him there for a reason. He's a dear friend of mine, Dr. John Trowbridge. He is a man who's written a book, The Yeast Syndrome. He knows a lot about yeast. And someone asked him the question, Dr. Trowbridge, do I have to treat this for life? Can I ever have a glass of wine? I think you'll enjoy his response. Cancer and diet. So often oncologists hear, what do I do for supplementation? Is there a supplement? Can I change my diet to help me with my cancer? And folks, this isn't something they learn in medical training. I think you'll enjoy that segment. Doctors Mark and Angela Stengler, they're medical NMDs, naturopathic medical doctors. Just a potpourri of topics we're going to cover with them in 5 or 6 minutes in the middle of the show. And I'm opening with this, and you've watched me long enough. I've been on television going into our 26th year. Wow. What can a little mold hurt? A little bit of mold, just tiny sniffles, little sneezes, or could it be worse? All that and more on this, Know the Cause.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
With the holidays behind us now, the holidays of 2021, many people have access to my cell number and they text me, my own attorney and people like that. I got 17 texts from very, very sick people. And you know what the response in 15 of them was? What can a little sugar hurt? Today I want to address what I've talked about for 23 consecutive years on Know the Cause. You've gotten old with me. And that is, what can a little mold hurt? Okay? Welcome to a short study of the one fungus that makes one of the most lethal poisons ever known to man. It's called Aspergillus flavus. Thank you, sciencephoto.com, for this picture. Look at that. You know how Aspergillus got its name? The old Roman Catholic priests, look at that stem, and then you've seen the Aspergilli that the Roman Catholic priests, I was raised Catholic, sprinkle all over the audience, holy water all over. That's how it got its name, hundreds of years ago. It looks like that, a stem with a head on it. Isn't that fascinating? That is Aspergillus flavus. Folks, here's what I want to teach you today. I have a short time to do it. There will be 100 to 200,000 deaths, I believe many more than that, but that's what science is saying, due to liver cancer a year, and our doctors in America don't know this. They have no idea, most of them, 99% of them, that this mold can cause human liver cancer. None. Okay, let's keep going. Aspergillus flavus is a common fungi which frequently grows in indoor environments and often contaminates food and feedstuffs. Food is what we eat, feedstuffs is what animals eat. Aspergillus flavus is notorious for producing the highly carcinogenic aflatoxin mycotoxin. Aflatoxin production is common in poorly stored human foods and animal feeds, and especially common on damp corn and peanuts. I've got to tell you, for decades, I've read the studies on peanut and corn. Look, I avoid them. Corn looks so good to me, and I think it's neat that we put butter on it, which has antifungal properties, and same with peanuts. Peanut butter, it always looks so good to me, but I have avoided it for decades and decades. I'm worried that some of our corn and peanuts have mold growing on it. For me, it's easy to avoid it, okay? Extended eating of Aspergillus flavus mold on foods likely contributes to up to, and I think it's triple this, but up to 155,000 worldwide cases of liver cancer annually. By the way, that comes in environmental health perspectives in the year 2010. Imagine what that number is now. You don't go to an oncologist with liver cancer And the doctor doesn't say, gee, are you eating peanuts? Are you getting into a lot of whole wheat? A lot of grains? Do you live in a moldy environment? Could we put a test plate in there and see if we can find Aspergillus flavus? Ain't gonna happen. Doesn't happen. Nowhere. How I wish it did. I think we could save a lot of lives. I think we are chemoing liver cancer patients when what they need is antifungals to help them get better. By the way, if you're a patient with any type of cancer, ask your doctor to consider fungus. Sporanox, a drug that kills toenail fungus, was approved, 6-7 years ago as a cancer drug, and it really seems to work well. Okay, so consider that. Additionally, Aspergillus flavus mold exposure is related to asthma, chronic fatigue syndrome, and many other health problems. A number of studies have reported that Aspergillus flavus and other Aspergillus species, by the way, it's called Aspergillus parasiticus, are often found in damp indoor environments and are often associated with asthma, sinusitis, neurological problems, chronic fatigue. We've talked about multiple chemical sensitivity. This is it. Headaches and significant reduction in concentration. This is a study, the same study that came out in 2010. You guys, think of your home. Think of a classroom. Think of your office. Are you in a moldy, older building, and are you having multiple symptoms? You run to a psychiatrist for this one, you run to a gut doctor for this one, you run to a bone doctor for this one, you run to a skin doctor for this one. You got to take a day off work to get all the doctors done. Think fungus. You can starve them and you can kill them, but you got to do both. You can't just live on a Kaufman 1 diet if you've got a bad fungal problem and have that work. You've got to simultaneously kill it. Drugs will do it, but so will great supplements like the B vitamins, oregano, all sorts of things that I talk about. Aspergillus flavus induces neuroinflammation and brain changes. This is how powerful this is. This was a study done here just recently. An Indiana study reported that rodent inhalation of fairly heavy levels of Aspergillus flavus was associated with pro-inflammatory expression in many areas of the mouse brain. Aspergillus flavus produces changes in the brain gene expression that may produce significant dysregulation in both humans and animals. It's important that we know this. It's really important because your psychiatrist doesn't, your doctor doesn't. Place a petri dish inside your home and see if Aspergillus flavus is growing inside. Of the 1.5 million species of fungus, very few actually cause human illness, 30 to 50. So don't be paranoid, but be smart. Says the American Center for Disease Control, a key clue to when a sick person may have a fungal infection is that he or she is being treated with medications for other types of infections, but does not get better. Please find a doctor who knows about fungus. Get on the phone, go to a pharmacy, go to a health food store. Is there a doctor who can say fungus, mold, mycotoxins? That man or woman is worth millions of dollars to you. They may cut to the chase, offer antifungal protocols, and you've been running from doctor to doctor. Find one who knows yeast and mold and treats for it. Hope that helps.
We really do, but to your point, what we do with patients is we don't rely on blood pressure readings at the beginning of a visit. Matter of fact, even in medicine, you're supposed to get multiple readings over time to diagnose high blood pressure.
Dr. Stengler and Stengler, Angela and Mark Stengler, they're naturopathic medical doctors. Welcome to the show. Thank you so much. And I say welcome to the show. I've known you guys for 15, 20 years. Mm-hmm. Brilliant work you're doing. So I go to the dentist, he puts this thing on my wrist. And he says, Doug, you have hypertension. You have high blood pressure. It's 150. I thought, I've never had high blood pressure. So Ruth says, get a good cuff. Do it up here and see what happens. I go 118. Now, I don't like going to the dentist to get my teeth cleaned or anything. So maybe that's what elevated it. Your clinicians, do you see a lot of hypertension or high blood pressure?
We really do, but to your point, what we do with patients is we don't rely on blood pressure readings at the beginning of a visit. Matter of fact, even in medicine, you're supposed to get multiple readings over time to diagnose high blood pressure. Many people go in their doctor's office, oh, you got high blood pressure. Well, they just try to survive driving on the freeway, especially where we live in Southern California, you know. You're going to the dentist thinking about needles and stuff. So we want multiple readings, okay, at home to see what you're averaging. That being said, we do see a lot of people with high blood pressure, and there's different root causes why that is we always want to treat. Blood pressure medications are one of the most common prescriptions. Sometimes they're indicated, but if you don't need them, if you can change your diet, lifestyle, supplements, that is a good way to go because blood pressure medicines often are the cause of dizziness, lightheadedness, fatigue, amongst other problems.
Yeah, no, I absolutely agree with that. And I always look at family history because we have our patients fill out a family history form and it'll click off hypertension, father, mother, grandfather, grandmother. And you're like, whoa. So this hypertension episode in the office might not just be a white coat hypertension. That might be something that this person is going to be dealing with later on.
Because you're naturopathic medical doctors, do you look at herbs or nutritional alternatives? Boom. Here you go. You're not smiling, right? Here you go.
Yeah. Well, Doug, what we do, because 75% of people overweight start usually with weight loss. What we do with our patients, if they have mild to moderate high blood pressure, we prefer to just treat them naturally for a couple months. In all those cases, they'll come down to the normal range. If they're really severe high blood pressure, you got to use medications while we're still doing natural treatments. But in any case, natural treatments can always be helpful.
Almost my favorite cases are when someone's on 2 blood pressure medications and it's still not controlled. I kind of like that challenge because then we can add lifestyle changes and some herbs or nutritional supplements to lower the blood pressure. All of a sudden they see a difference. I'm like, okay, now we can slowly wean off of their blood pressure medication because what was it really doing? We're really not sure.
See, that's so true. I watch ads on TV. It's no more common to say, take this drug instead of this drug for your depression. Now, stay on your drugs for depression and use this drug. Polypharmacy. It's all over the place now. Give me, if you would, a hint as to what people watching this show. Number one, folks, do not stop taking hypertension medicine or antidepressant medicine. Always work with your doctor to do what we call titer down, or reduce the dose or eliminate it, like Dr. Angela said. Are there supplements? Let's say someone's never been on high blood pressure medicine. They're going through a lot of stress in their life. Cortisol is just oozing through their body. Would you try natural approaches to lowering their cholesterol? And what might those be?
Absolutely. So the first thing, we talked about nutritional deficiencies, previously in other shows. And so omega-3 fatty acids, if those are low, that's kind of a way to prove to them they need to take those. In addition, studies are really good with magnesium and blood pressure. And so those are 2 things that, I usually start with first, as well as taking their blood pressure 3 times at home for just like 3 days straight, because otherwise it's going to cause more hypertension because they're stressed out taking their blood pressure.
Can I say the COVID word? I have some friends who are deeply concerned about COVID. Number one, they wonder if they should have gotten the shot because there's a new variation, or number 2, I got the shot. Is there a way to get it out of my body? This alone, stress can induce, we've known this, hypertension among other problems. Do you see a lot of that in your clinic right now? People wondering, what's the next wave here? Will there be another wave? Or I took the shot, is there a way to detox from it?
We see a lot of people concerned about that. That is true. And so a lot of the holistic doctors, we do use things like resveratrol. It may have benefits in helping with spike protein lasting in the blood vessels. A lot of people get thick blood or coagulation problems post-COVID. We use enzymes like nattokinase to naturally thin the blood. Don't combine them with pharmaceutical blood thinners. But yeah, there are some protocols like that we actually have been very, very happy with. Have helped a lot of patients.
Yeah, I'll bet. And once again, we talked about skin symptoms and the gut association. I have to wonder about stress and migraines and everything we deal with, and the gut association. Dr. Angela, Dr. Mark Stengler. For more information on what they do and where they are and who they are, Dr. Stengler, drstengler.com. Thank you, guys. If I were an oncologist, a cancer doctor, thank God I'm not, I would feel the same way Dr. Richard Frank feels. I pulled this off WebMD. With 20 to 90% of cancer patients using supplements, oncologist Dr. Richard Frank is confident with the cancer questions and his answers. But then come the questions that I'm not so confident answering. Inevitably, every patient asks me, what should I eat? How can I fight the cancer by eating the right foods? They want to know which foods will actually help them fight the cancer better and live longer. They don't know. Have you ever gone through chemotherapy or walked in a chemotherapy where a lot of people are getting IV chemotherapy? What kind of food is there? Donuts? Soda pop? Folks, this is unbelievable. Why wouldn't you teach in medical training? They don't. Clinical nutrition. More importantly, how about clinical mycology? Did you know that fungal poisons can grow on our grain supply, peanuts, popcorn, things of that sort? Mostly wheat, corn, and peanuts. Did you know that? I was shocked when I went to the cancer website, cancer.gov. Here's what I learned. The American Cancer Society diet recommends 100% whole grain breads, rolls, English muffins, bagels, ketchup and mustard, whole wheat and corn tortillas, cornmeal, whole wheat crackers, breadsticks, breadcrumbs, savor a frozen treat made from 100% juice, or put a half a cup of melon slices, peaches, and other favorite fruit on a toasted whole grain waffle. Popcorn. Instead of using butter, give it some zest. Instead of using butter, didn't we already go through the margarine days? Butter's good. And then it said this, American Cancer Society, when you're traveling, fill a small bag with dry whole grain cereal, dry roasted peanuts. Most people know about the short-term effects of drinking alcohol, such as effect on mood, concentration, judgment, and coordination. And then there's this on their website. But alcohol can also have long-term health effects. Wow, not ill health effects, health effects. Folks, you got to be careful out there. They also put on their website things I would eat. You know, you go to Genesis. I give you every green plant that's yours for food. Eat it. I mean, it's important that we look at good whole food, grass-finished, not hormone and antibiotic-fed beef, eggs, things of that sort. So we've come a long way, but we still have a long way to go when it comes to helping cancer patients. Hope that helps. Folks, Charles asks a great question. Hey, Doug, what can we take for fingernail or toenail fungus? Folks, that's been given a name. Like everything, to keep the simple facts and we, the people, it's called onychomycosis, toenail or fingernail fungus, right? And a drug, of course, came onto the market. And then another one. Now there's several. Lamisil, terbinafine, Sporanox, itraconazole. These are drugs that can stop this from occurring. Fingernail and toenail fungus. Before that, you know what we had? We had Vicks VapoRub. We had Melaleuca, tea tree oil. We had natural things, and it took months. But after we'd shower, if we dry our toenails or fingernails and put some Vicks VapoRub, which is camphor oils, which are antifungal, or we put Melaleuca or something on it, and months and months and months later, it would get better and better. Now we have drugs that are what we call systemic antifungal drugs. I took exception to these initially until not long ago, 5 years ago, the American Medical Association began realizing that these drugs that kill fingernail and toenail fungus could be repurposed into cancer drugs. Not fingernail cancer, systemic cancers. Tell me there isn't a fungal component to cancers. You have to weigh the benefits against the risks like anything else. Is taking a drug over a 4 month period of time worth getting rid of the toenail or fingernail fungus? Or would diet, Melaleuca oil or tea tree oil on my nails over an extended period of time do the same thing? We're all thumbprints when it comes to our illnesses, symptoms, and diseases. If it's not threatening, life-threatening, then I would try the natural approach first, and if not, go to a doctor and maybe try the Lamisil or Sporanox. I hope that helps, Charles.
You've got to be better.
The book, Dr. John Trowbridge, loved this guy. 42 years ago we met. The yeast syndrome, how to help your doctor identify, I love this, you're paying the fee, how to help your doctor identify the real cause of your yeast-related illness.
You know that book is tossed aside by more doctors than you can shake sticks at.
Yeah, I'm
Patient
sure.
gives it to them and they... throw it.
And this is from a physician with a master's degree in nutrition, and they'll throw your book away.
But I'm a quack.
Yeah, quack. If it walks like a John Trowbridge, right?
Yeah,
They say if it
that's
walks like a Doug and it talks like a Doug, it's probably a quack. Okay, want to talk to you a little bit about a question I got. Will I have to keep treating this yeast problem for the rest of my life? I mean, will I ever be able to have a simple glass of wine or a bagel again?
Do you like lox and bagels? I love lox and bagels.
Yep.
The problem is not the yeast, okay? The problem is you, the person. Now, if you reconstitute your defense system, your glands functions, the rest of your body functions and such, you'll be a healthy person. What do healthy people do? They tolerate lots of stuff, including yeast. Okay, not an overwhelming amount, because remember, in this country, okay, we have sugar snacks and soda pops and we overwhelm the system. You know, your pancreas, we've talked about metabolic syndrome in the past. One of my friends was the professor who discovered that, okay? This is simply where you put too much sugar in that's beyond the ability of your pancreas to do it. It's called type 2 diabetes as it emerges and such. Well, guess what? That's because we can eat 3 apples and you're not ready for number 4, but we can drink the juice of 16 apples along with a few Oreo cookies. Now that's an overwhelm. And so if you're reasonable about it and you get your body reconstituted, you can enjoy a regular, happy, healthy life.
Okay, let me ask you this question, because I get asked this a lot. Popular today are these capsules with 20 fruits and vegetables that you swallow down. Gut and metabolism ready for that? Or
Absolutely.
should I eat a strawberry from time to time?
Oh, strawberries are good too, but actually, you know, the thing is people are starting to look at this seriously in terms of making good shakes and stuff.
Yes.
And these fancy capsules and stuff. That's not the sum total of your nutrition. That's to get little trace factors you might otherwise not have, because you don't have a rainbow selection of colors on your plate.
That isn't in lieu of eating a good diet. That's an addition.
It's a nice compliment, and maybe helps keep you, you know, I have my famous green drink in the office, and people go, what is that? And they go, do you want the recipe? You know, it's about 12 different things, you know, all put together. And they go, oh, it tastes bad. No, it tastes good to me.
How old are you? Men can ask that question. If you were a woman, I wouldn't do that. But how old?
87.
Gee, you look great.
I'm 76.
76. You still fly. You're still a pilot.
Oh, yes, all over the country.
I mean, and look at you, really. I mean, you feel good. You danced in here through makeup and so forth.
Needed the makeup.
Did our dads, John? I mean, I maybe it's because I'm so old now, but I don't remember Dad feeling this good in his 70s.
No, but you know what? They grew up eating real food, and so they had a longer time in which they were really more vibrant and such.
Okay.
And my best patients are rural patients. They're still out in the farm. They're still eating like they were. They're still, you know, getting up early and going to bed early and not getting stressed and such. Stress is incredible. I did a lot of study on that. My lab director at Stanford wrote the very first paper on what is now called mind-body medicine. And I wrote a paper for the Rotarian magazine in 1984 on stress, and it was reprinted in 19 different languages. It was immunobiology.
Remember that?
Exactly.
Ta-da.
Yes, George
Great.
Solomon. Yes.
Great to see you today. Thank you so
Thank you,
much
sir.
for the education. The Yeast Syndrome, $8.99. Great book. Thank you.
Thank you.
Folks, isn't it fascinating? I mean, what we try and teach you is how to be well. 75 years old, I feel better than I did at 35. It's taking a lot of work. I can't eat the way old guys eat. I have to exercise on a regular basis. I feel so good, and you can too. Proper diet, little exercise, proper supplements, prayer life, everything plays a role in this. So when I open the show talking about what can a little mold hurt, the wrong mold does more than hurt. It can take you down. How I wish doctors were taught this in medical training. Thank you, Doctors Mark and Angela Stengler. Kind of a potpourri from hypertension to omega-3 fatty acids and so forth. Thank you for coming in and honoring our viewers, and there are a lot of them. Thank you, Charlie. Good question. Fingernail fungus. What do I do about that? Dr. John Trowbridge, I think he and we've known each other decades, 3 or 4 decades, and we get asked that question a lot. Do I have to be on this diet forever? Do I have to take caprylic acid or omega-3 or bilberry, all these pills forever? Sometimes yes, sometimes no. God bless you. See you next time. Bye-bye.
The preceding program, Know the Cause, was paid for by Mediatrition Incorporated.